everyone, and welcome. My name is Lauren Cipoletto, and I'm a recent graduate of Wake Forest, now Presidential Fellow at Z. Smith Reynolds Library. With me today are Dr. Joanne Clinch, Clinical Director of Student Health Service, Tim Aumann, University Chaplain, Matthew Clifford, Director of Residence Life, and Dr. James Raper, Associate Director at the University Counseling Center. Today we're going to discuss different concepts of well-being and how students are affected here at Wake Forest by these concepts. My first question for you guys today is, what is well-being and what does it look like for college students?
Well, I think one place to start would be to think first about kind of what well-being isn't and how that can look. We've kind of seen that a lot at the Counseling Center. Typically that can look initially like maybe some significant anxiety that's getting in the way of social relationships, of classroom performance, even to the degree of becoming panic attacks, getting ready for a presentation, something like that. Having some difficulty in social relationships or relationships from home or in families, and that's kind of coming up for them. Some over-focus on food, some over-focus on whether your body looks, or maybe over-exercise, maybe not paying much attention to those things at all, actually, and not taking care of oneself physically. And then probably one we see a good deal is the use of substances like alcohol or other drugs to kind of cope in ways that kind of get in the way or are detrimental.
I like the concept and the definition of well-being versus wellness. I think there's a lot of buzz out there about wellness, and certainly as a doctor talking about that, and the way people, I think, embrace that is physical health, physical well-being, emotional and psychological health. But well-being really is a much broader concept. It really encompasses all aspects of our life, including certainly physical and emotional, psychological health, but also financial health, spiritual health, for our students, kind of that intellectual, student vocational health, social and relationships certainly play a role in that. And then, also environmental health are all those facets that taken together create this overall concept of well-being. And each of those is really very intertwined. They can't stand separately. My picture of that in my mind is a spider web, which can hold the weight of a spider, but each of those threads is very delicate and woven together. And if one of those areas, one of those aspects of our lives is impacted, it's hard for other areas not to be impacted, and that can certainly decrease the structural integrity of the web, or when we're thinking about well-being, how someone is, how well they're doing in their lives. An example for us as adults that we can probably conceptualize would be, if we have a financial strain or a physical health strain that's impacting our job performance, our bank account, that certainly is going to spill over into other areas. It can spill over into the spiritual aspects of our lives, those questionings about why is this happening to me, relationships with others, and is, again, very multifaceted. For our students, certainly it's the same thing. Sometimes our students are really impacted by their academics. They're here, they want to do well, and that then can impact those other areas of their lives. And a weakening in any of those threads can weaken how they're doing. Sometimes those areas are really strong, appear to be very strong, and students are overachieving and wanting all of those areas to be very tight and strong, but that increased pressure and tension on that spider web can also decrease the integrity of the strength there and of their well-being. So if they're shooting to be on the dean's list and in 3 or 4 different academic societies and in clubs, they're also engaging with relationships and friendships on campus, athletics, and they're just overextended, that really can impact in a negative way their well-being.
You're all in different offices on campus and see well-being from a different angle. What are some examples of ways that you help guide students toward well-being?
Our beliefs, our core values define who we are. And everything that we think, everything that we do is filtered through those beliefs. They frame the way that we think about ourselves. They frame the way that we think about a roommate or a classmate or a fraternity brother or a sorority sister. They frame the way that we think about the world that we live in. So when we talk about spiritual well-being, what we're trying to do in the chaplain's office is to create a safe environment for people to ask the really interesting questions. the really fun questions that we all should be asking at every age and stage of our lives, like who am I? And why am I here? And what do I do with these gifts and graces that have been bestowed upon me? Who is my neighbor, especially my neighbor who may be alarmingly different than I am, and do I have a responsibility to them? So we want to create an environment for students individually and within communities to explore those really big questions. We also want them to develop a deeper appreciation for the traditions that they come out of, philosophical traditions, religious traditions, spiritual traditions, so that they can exercise their faith or their worldview and do that without apology. The other thing I think that's really important is one of our core values that we want to encourage at Wake Forest is that everything that we do out of a sense of deep gratitude. This is an amazing opportunity for students. It's actually an amazing opportunity for staff and faculty in the short time that we're together to explore those really big questions. So we encourage that. We do that together as a community, and then we reap the benefit in a spirit of gratitude.
In Residence Life, we certainly take a very specific angle at the community aspect of well-being, the social aspects of well-being, and certainly to echo a lot of what Chaplain Aman mentioned regarding the individual and making sure that each individual student, each resident in our community feels that they can express their authentic self and that they know their authentic self, but also that they can know each other in a community. I think a pretty salient example for me comes through a class I teach for our resident advisors, and we ask them to look at their community, to really essentially map their community and look at their community as individuals, what's happening with each individual on their floor. Are they doing well academically? Are they struggling to connect socially? But then also, how is the community as a whole? How are individuals interacting? And what can the RA do as a staff member to help create an inclusive community, to help individuals where necessary feel that they can again be known authentically and express themselves in a genuine way, but also how are those members interacting amongst each other and in a way that promotes social well-being as well as environmental well-being, the space, the place where they are. Certainly there are factors in their physical space that help contribute to their overall sense of well-being. One of those links in the spider web that Dr. Clinch mentioned.
From our office, the easy concept of that would be, what kind of services do we have for health? And we certainly do provide care for acute illnesses and injuries, helping students manage those chronic medical problems that they come to school with. And we really encourage them to think of us as their primary care provider. You know, they're here for 9 months out of the year, and it's important to take care of those medical issues that they've had their home physician care for over the years. But we also have other things that help to prevent illness. Flu shots, so I'm going to make a pitch to parents to encourage their students to get a flu shot so that they're not missing finals and coming home and having to take their finals when they come back. We have an international travel medicine clinic, so that helps our students to take advantage of those opportunities to study abroad or engage in service trips, but do it in a way that protects them from illness and has them prepared also for some of the social components of travel. But it's much bigger than that. So we'll do all of those things, but when I have a student come into my office, I'm looking at them through a different lens than I might if I were in private practice, not in a college health service. And I'm thinking about all these people around the table and other people within our campus resources that aren't here. So an example of that might be a student who comes in and they're having difficulty sleeping. And I'm asking questions about is it too noisy? Is it too warm in your room? What's going on? Is your roommate coming in late? But also what's going on in your life? And it may be that they're struggling with a course and they're very anxious about that and they don't know how to address that. So I might direct them to the Office of Academic Advising or to the Learning Assistance Center or to a tutor. It could be for another student that they're really having a hard time engaging and making that transition to college and haven't found their niche yet or their community. And so I might be reaching out to Matt to talk about what's going on in the residence hall, or get them engaged with campus activities or with our first year mentor program. So it's a much different lens. It's really a holistic kind of lens. So we're going to focus on all those big issues like sleep and nutrition and exercise, and we have great staff that can help them with those issues. But each visit, I think we take the opportunity to get deeper and understand how the campus environment is impacting our students.
This is a place where you can get free therapy, and when else are you going to get free therapy in your life? So to take advantage, and I think maybe freshmen and sophomores may not think that's as funny, but I think once you get closer to being able to graduate and being on your own, they kind of go, yes, I want to take advantage of that. One way to think, I think, about well-being from a counseling center point of view is maybe to imagine one student who comes in. This is an experience I've had pretty frequently in the time that I've been here, where a student will come in their first or second year and will typically come in only when things are bad, where things are wrong, where there's a bit of a crisis. And we certainly provide crisis service. We provide a counselor on call when school is in session. So they might come in and say, I had a panic attack before my presentation, or I just can't get along with my roommate. I got to get out. It's not working, and it's the third day of the first semester. So that kind of what I would assess is sort of first look at, what isn't really working for them. What am I evaluating? Maybe it is the roommate, but maybe it's also sort of their ability to kind of tolerate a little bit of distress, which is an important value in terms of well-being, in terms of the emotional component of it. It's not just being connected with your emotions, which is something we'll focus on, and understanding your emotions, listening to your emotions, but also learning how to tolerate some distress, tolerate conflicting emotions at the same time. I can feel both frustrated with you and like you at the same time. And that, for a 17, 18, 19-year-old, that's very, very difficult for them to reconcile sometimes. So we'll do that. And you imagine that same student, maybe in their junior and senior years, will start using counseling, and they might come back, they kind of go, I know James now, I can go back, and maybe I just want to start talking about stuff before the crisis happens. And I think that's a really big identifier or marker of growth and a little bit more engagement in the sort of holistic well-being. So they're wanting to identify meaning. That's something that I know Chaplain Alman is really seriously connected with, and I think we have a nice symbiotic relationship, our two offices do, around exploring meaning. So that those questions of who am I, and how do I make relationships with people, who do I want to surround myself with, making different choices about alcohol use is something I hear a lot about as folks grow older in college. Being more aware of not just, and I understand jobs and employment and a paycheck is really, really important, but also kind of going, well, maybe it's okay if I choose the position after I graduate that isn't the highest paycheck or doesn't come with a signing bonus, but is something that really is rewarding to me, that really is, kind of gives me passion, that I'm engaged with. So that's a kind of a brief snapshot of if you think about kind of a longitudinal study of one student, this imaginary student that we see over and over and over again. It's really rewarding for us. That's why we love working with college students.
I'll ask one last final question. It's obvious that parents play a significant role here. How might that role look different today than it would have in the past?
Well, I think we see parents' role shifting from that of a director, maybe more so to a consultant. No longer are parents able to set the scene for their students and set up props and what have you, and kind of say, go. Where it's now, students are writing that script and they're setting that scene. Parents are backstage, hopefully in a consultant role, be able to offer some very valuable advice and connections for their student, but really allowing the students to create their own narrative at Wake Forest as a student, hopefully with a sense of holism and well-being.
Thank you so much to all of our panelists today for joining us and discussing well-being here at Wake Forest.